Whether you have pain in your back or joints, surgery may not be the answer. Instead of the dangers involved in cutting out tissue, consider healing and rejuvenating the area with stem cells, platelet-rich plasma, or prolotherapy. The treatments that are available to professional athletes are now available for you. Watch the videos at jointrehab.com or call the Darrow Wellness Institute at 800-300-9300. 800-300-9300. That's 800-300-9300.
Welcome back to Living Pain-Free with Dr. Marc Darrow. We're taking your calls at 866-870-5752. I'm your host, Nita Valens, and right now we're speaking with Antoinette.
Antoinette, Dr. Marc Darrow, hang with us here for a second. I'm going to give out the phone number again so we can get some more callers. We love our callers. 866-870-5752. When you call, we'll send you out a free copy of my book, which is Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It's a 200-page book, 250 studies on how platelets and stem cells help to heal the body and how surgery can hurt the body. So I was just looking at this book at the break, and I was talking, in the beginning, it's got an introduction about, or a foreword about my grandfather, Edda, who was a doctor born in the 1800s, and how I was forced by my mom to spend time with him when I was a kid. Because she knew I was going to be a doctor, and I knew I was going to be a doctor, but I always would rather be playing baseball. So, interesting thing about my grandfather is he had many mentors. And one of them, Henry David Thoreau, I'm writing about this in my book, and I'm reading it here. And I wrote one of his mentors, and his name was Eli, but he called himself Edda, E-D-D-A, which was the book of wisdom of the Vikings. And so he named himself Edda. We called him Edda. And one of his mentors said, I'm reading this, "If a man does not keep pace with his companions, perhaps it is because he hears a different drummer. Let him step to the music which he hears, however measured or far away." Nita, do you remember who that was? Do you remember Walden? You remember Walden Pond?
Oh, yes.
Henry David Thoreau.
Wow.
Yeah, so my grandfather Edda loved Henry David Thoreau and his teacher, Emerson. Remember Emerson, who wrote all the essays?
Yes.
So I had very early teachings from a very wise man, my grandfather, about not following the herd. Always do what you think is right, even if it goes against what other people think. And that's how I've been in medicine. I was almost thrown out of medical school because of the way I thought. I was threatened all the time. I didn't like chemotherapy for one thing. I thought, healing cancer is possible to do it naturally. And I was told to shut up or I'd be in trouble. And there were a lot of things like that going on with me, and I had to kind of keep my head up and down at the same time. I wasn't going to shut up because when I went to med school, I started at the age of 41. I'd been a lawyer for 15 years, and I had a big mouth. And it was hard for me to shut up the way they wanted me to. And I always followed teachers in medicine who did things a little bit different, who did things naturally. Even though at the time I wanted to be a surgeon, and it wasn't until I had a bad shoulder surgery that I jumped ship and got into more of the natural medicine. So we have to be careful. I'm not here to preach about what anyone should do, because everybody has to follow their own, the beat of their own drummer. And for medicine, I choose what I consider to be the high ground, which is more of natural healing. And I don't like, just to be honest, I don't like surgery very much when it comes to orthopedics unless it's really necessary. And I find that about 99% of the surgeries that I see done in orthopedics, in my humble opinion, should not be done because we have ways to heal now, which is called regenerative medicine. And unfortunately, orthopedic surgeons don't believe in it. But I tell them when I talk to them, and these are my friends, I go, well, I don't believe in surgery. And then we have a little discussion about them hurting people and them saying what I do doesn't work. And I go, how do you know it doesn't work? And they go, well, I tried it once. And these treatments of stem cells and platelets, you know, a lot of times they have to be done multiple times. We're growing tissue, okay? It's not like this definitive, I'm going in Friday morning at 7:30 for a surgery and it's over. And guess what, people? I get a lot of the failures where it's not over after the surgery. The misery begins after the surgery. So be careful. Don't get a surgery you don't need. Don't get talked into it. Get on the internet. Read about surgery. Read about regenerative medicine. And if you call up, we have a bunch of callers here waiting. We're going to send you a book that I wrote called Stem Cell and Platelet Therapy, Regenerate, Don't Operate. And I will pay the postage, too. It's got a foreword by Suzanne Summers. God bless her. And Antoinette, I appreciate you so much. Antoinette, give us a call at the office. You get a free consult by my staff at 800-300-9300. And we're going to go on to Don, who's also got hip issues. So Don, tell me about your hip. Dr. Marc Darrow here.
Yeah, hi. They say I have neurosis of the femur.
Avascular necrosis?
Yes.
Okay.
The femur.
Yeah, I hear you. Are you having pain?
Don, are you driving? Can you hear us?
Yeah, let me get you off the. Yeah, I think that's better now.
Yeah, it's better if you pull off the side of the road and focus and get off the Bluetooth. Anyway, what I'm thinking you're saying is that you were told you have avascular necrosis of the femur. Is that correct?
Yeah, both femurs.
Both sides. Okay. Are you talking about the actual hip joint itself?
No, they're not talking about the joint, the bone.
Where in the bone?
The femur.
Well, the femur is the long bone. It's the thigh bone. What part of it?
It's the very top, the ball.
Okay. That's the joint.
Oh, okay.
Yeah. I was wondering because it's very, very rare to get it along the shaft of the femur. So, yeah, that's a very common situation. And depending on the stage of it, I may or may not be able to help you. And stem cells are very good for that. It can still help regenerate more cartilage. And are you able to walk?
Yes.
Okay. Are you having a lot of pain?
If I'm working and like getting up and down, I can't even sleep because the pain starts hurting my knee, my back, my butt.
Okay. I got to examine you. You got a lot of complex things going on there.
I actually, I sent Julia my CT and X-rays.
Okay. I appreciate that, but I tell every single person, I'm not going to be able to tell you anything unless I examine you. I appreciate the fact that you have CTs or whatever it is that shows that you have avascular necrosis, which sounds like a death sentence. But I take care.
I had a heart transplant in 2019, and they had, I couldn't get on the list. It took so long, and by the time I got on the list, all my organs were failing.
Okay.
And I'm pretty sure that's when all this started.
Okay.
That was 2019.
All right. Well, God bless you, man. You've been through a lot. It's a lot to go through. I'm glad you sound good. You're probably doing pretty good.
So, Dr. Clapper is saying I need a hip replacement, but I have a lot of questions to ask him.
Okay.
And I'm scheduled for December 6th.
Okay.
And I'm just not sure.
Okay. Well,
I heard, I saw the Mayo Clinic. They're doing, I think it's called decompression, and it's like a stem cell into your femur.
Okay.
Do you guys do that?
I'm not sure what it is you're talking about, but can I talk for a bit?
They do stem cell into your femur.
Okay. May I speak a little bit?
Yeah.
Okay. So I want you to hear this. I treat people with avascular necrosis frequently. They get better. What avascular necrosis theoretically means is that there's no blood supply to the bone. That may or may not be the case with you. And depending on the amount of damage, if there is any, I have to examine you to find out. I'm not going to tell you based on your CT scan. I look at it and it's important, but the most important thing is your examination. I'm not even sure that your pain that you're talking about is even coming from your hip joint. You know, we just talked to Teresa about her hips. I don't know if you're on the radio listening then. And I'm not sure that her pain was coming from her hip joint at all. And I'm not sure it's coming from yours either. You can have avascular necrosis and not have any pain. Is this registering, Don?
Registering?
Is it registering? Are you understanding what I'm saying?
Yeah.
Okay.
Yeah. This has been going on for, like I said, maybe 3 or 4 years.
Oh, that's fine. I'm sorry it's going on, but that doesn't change anything. It's there now.
Okay.
And the most important thing for you to do is get an opinion from a doctor who is not a surgeon. You can go to 50 surgeons. They're all going to tell you the same thing, most likely. You need to go to somebody else.
Well, I was waiting to talk to you after you had a look at those X-rays and scans. So it seems like the doctors look at the white part of the X-ray, and they just, their conclusion is you know there's neurosis of the femur there.
Yeah, I hear you, but I'm not agreeing based on our conversation. In my humble opinion, my friend, you need an examination. Then I can tell you what's going on. If you want to write down the number, it's office number. You get a free consult with my staff, 800-300-9300. I would do that and then get an appointment. You get a consult, come on in, and let me put my hands on your legs and hips and move you around and see what's going on. I may agree with your surgeon. I may disagree. I don't know.
Okay. Yeah, I've actually called like 3 times.
Okay.
And I'll call again. Can I call now to make the appointment?
Yeah, there's people answering the phones now, but yeah, make an appointment. I'm glad you sent in your CT or whatever it is, any imaging, but I don't really care about that. I care how you are, not how your X-ray, MRI, or CT is. I see terrible images all the time, and the person doesn't have problems. All right?
Okay. And my surgery is supposed to be scheduled December 6th. I already backed out of going to Krillin and Job. That was supposed to happen November 7th, and I just said, I'm just not sure.
Well, the first thing you do is get an examination, then decide what to do. And listen, I'll be honest with you, man. If I think you need a hip surgery, I'll send you to do it. I just don't find that very commonly.
Okay, Dr. Darrow.
I mean, I can't remember the last time I sent somebody to surgery. I know I have over the past 25 years, but I can't remember the last time. It hasn't been recent.
That's pretty amazing.
Well, I'm not saying people haven't gotten surgery behind my back, because I don't follow up on every single person forever.
Sure.
That's their choice. And I'm honest with people. If I think they need a surgery, I'm going to tell them. And by the way, your surgeon's a good surgeon. He does probably the most of anybody in Los Angeles.
Well, it was either that or to Barry, and he's Krillin and Job, and that's all he does is the.
Yeah. Well, at least if you get a surgery, you're going to good guys. There's another great one I love in Santa Monica named Yoon. He's very, very good.
Yeah,
and these guys do these all day long. So they're the guys to go to if you're going to get the surgery.
Okay.
All right, man. God bless you. It's a pleasure talking to you, Don.
So do you think I could see you before December 6th?
I'll get you in Monday morning if you want. I don't care how busy I am.
Okay. Okay, that'd be great.
Thank you, Don.
Actually, you know what? I'm going to look at my calendar right now because I'm in front of the computer, and I'll see what's available.
That's a good idea.
Isn't that fun?
Yeah.
Monday. Ooh, we're busy, but who cares? We got to take care of this guy. Don, do you want to come in the afternoon on Monday?
Sure.
Okay. How about 2:30 Monday?
I have a video conference with Dr. Clapper because I had all these questions to ask.
Okay. Well, then do that. Yeah. What time are you available Monday?
I could come in earlier or later.
All right. How about 11 o'clock?
What time?
11.
Yeah.
All right, man. We'll see you then.
Oh, okay, great. Thank you, Dr. Darrow.
God bless you.
Thanks, Don. That's great.
It actually is great that he'll see me first and then talk to his doctor afterwards, because he'll have more questions for the doctor after he's done with me.
That's a good point.
But I know the answers of the doctor because I know the doctor, and he is a great surgeon, and I have a lot of respect for him.
That's good.
Yeah. I'm writing this down. Monday at 11 o'clock, Don. My staff will be mad at me, but I got to help Don.
They'll get over it.
They'll get over it. Exactly. All right, so I want to mention a couple things. We've been discussing the musculoskeletal system, the joints, the ligaments, the tendons, and cartilage regrowth, all of that with stem cells and platelets. But we also use these treatments on the face called the vampire facelift, which regrows the collagen in the face and makes people look younger. And it is pretty amazing. I'm not into aesthetics myself. I'm just getting older and uglier, and that's fine with me.
No, you're not. Not the uglier part, just the older part.
Well, the boyish part doesn't get older, but yeah, the body.
You're still 16.
I am always 16, the puer aeternalis. But we do this for the face. It's called the vampire facelift, makes you look young. And we can also do it on the top of the head. If your hair is thinning, it can help regrow it. It's not going to work for somebody like Dr. Phil or me that gave up their hair a long time ago. But if you're losing your hair and you're in that stage, it works pretty well to inject the top of the head to regrow and stimulate the follicles to produce more hair. So what else should we do here? I have another call coming in.
You didn't talk about what else goes on in the office yet.
Tell me.
Well, the vampire facelift for one.
That's what I just talked about, Nita. You had your ears clogged.
Oh, okay. It happens.
But just to repeat, because if Nita didn't hear it and she was listening, maybe you didn't hear either.
With headphones yet.
The vampire facelift is a treatment we do using either platelets or stem cells into the face, into the skin. We numb it up, and it regrows the collagen in the face. As we get older, our collagen dries out all over the body, including the face. Anything else, Nita, that I didn't talk about that I did?
No, but we have Teresa back from earlier.
Teresa is back?
Yes.
Teresa, one other question. You got it. What's up?
Teresa, are you there?
I'm back in the car. Turned you back on.
Okay.
And I heard you talking about collagen and the hair, and that got my husband's attention.
Okay.
And I was wondering, is that information in the free book that I'll be getting?
Yes, there's a chapter in the back about hair regeneration.
Oh, okay, great. And then the other question is, were you saying, because I haven't had the chance to call, if I call the office, is the consultation free?
No, the phone consultation with my staff is free.
Oh, okay.
Yeah, for more details
then,
about the whole procedure, of coming in and what that's all about, call the office. You can get details on it.
Perfect.
The website also has all that information, which is www.jointrehab.com. Yeah, drag your husband in too.
Yeah.
Grab him by the hair and drag him in.
All righty. Thank you so much.
All right. God bless you. So I'm going to give out the phone number once more.
Sure.
Love to talk to you. Anybody wants to call, and we have a couple minutes left. The phone number to talk to me live right now is 866-870-5752. Dr. Marc Darrow. I've been doing regenerative medicine for over 25 years, which is healing the body by stimulating new tissue to grow instead of cutting it out. I was on the path to be a surgeon. I loved orthopedic surgery in my training. I did tons of it. And I found there were too many failures, and one of them was my shoulder. My boss did my shoulder, and I'm not saying it was his fault. It's just surgeries don't always work out. And then I was able to inject myself when I learned about regenerative medicine, and I healed literally overnight. I'm not telling you that would happen for you. It often takes a few treatments. Man, I'm talking so fast. I need some water.
You want me to talk for a minute?
No.
Okay.
No. I can handle this, Nita.
Okay.
If I cut out, you can fill in. So I'm going to go to a question right now until we get other callers, if we do. And let's see what people have to say here. Okay, failed meniscus surgery. Meniscus is a little cushion between the bones and the knee, between the tibia and the femur, and it's very readily torn as we get older. Athletes have it. Both of my knees have medial meniscal tears. I have no pain. I run in the mountains all the time. I had a cardiac ablation I mentioned about 3 weeks ago, and so my doctor's not letting me run too fast, but I'm still sneaking out there a little bit. But I am walking every day. I walked, I think yesterday I walked 8,000 steps. Typically I get in about maybe 4,000. And
wow.
My knees are pain-free. I have injected them both of them with stem cells because I was frickin' miserable for a while. I had a lot of fluid in both knees. I did stem cells in both knees. They are healed up. The menisci look better. They're not completely healed, but the point is they don't need to be. Okay, we're out of here. So if you want to call my office, call right now for a free consult with my staff, 800-300-9300. And the website is www.jointrehab.com.
And thank you, Alex and Suzette. And stay tuned for Warren X 911 every Saturday. Please listen to thepetshow.com. I'm Nita Valens. We'll see you next time.
You've been listening to Living Pain Free with Dr. Marc Darrow. And now that you've heard Dr. Darrow, call his office at 800-300-9300 and speak to one of his joint rehab experts for free and ask for a copy of his book, Stem Cell and Platelet Therapy. Schedule an appointment by calling 800-300-9300. That's 800-300-9300. Or go online to jointrehab.com. Again, the website is jointrehab.com. Living Pain Free with Dr. Marc Darrow is heard Saturdays at 8 a.m., 10 a.m., and 1 p.m., and Sundays at 5 p.m. here on AM 870, The Answer. Take the first step toward a pain-free life. Call to schedule an appointment at 800-300-9300. That's 800-300-9300. Live long and pain-free. And thanks for joining us today.